Dole VA Veterans Town Hall meeting this morning. Next slide, please. First, I'd like to ask everybody to mute your microphones, just so we don't get any feedback from backgrounds. My name is Gene Kimball, and I'm the Deputy Public Affairs Officer here at Dole VA. I'm going to be your moderator for today's town hall. Today, we're planning to provide updates on VA programs and services, followed by answering questions. But let's review some housekeeping notes first. Next slide, please. Please be aware that today's session is being recorded so that others can view it at their convenience. If you have any questions at any point during the town hall, I encourage you to submit it via the chat window at your earliest opportunity. We'll try to answer those at the best possible moment. When asking questions or making comments, please refrain from sharing personal information, whether it be your personal information or that of a comrade or friend. We do want you to be aware that the link to this town hall has been shared publicly, meaning that anyone could be logged in and watching us. So with that, let's get going. Next slide, please. Mr. Michael Payne, our Medical Center Director, is with us this morning to share information with you about some things happening here at the Dole VA. Sir?
Everything, or just
We'll give him 1 minute.
Okay, it sounds like Mr. Payne is, I know he was in a meeting just a few moments ago, so sounds like he is on his way. Again, we will record this meeting, and at the end of the presentation, I'll show you where that meeting will be posted. It will be posted to the VA's website, the Dole VA website, at the bottom of the About Us page, and it'll be posted up later this afternoon with both video and the PowerPoint presentation. So Tracy, can you tell me, has Mr. Payne made it in yet?
Not yet, but he was running from the one room back to the conference floor.
Okay, so Mr. Payne is very busy, and he does a great job of making meetings. His calendar is something to look at. So just appreciate him taking the time to join us. Again, if you have questions during the meeting, put them in the chat window, and we will try to answer those as quickly as we can.
Just a note, sometimes outside participants do not have access to the chat window, and if that's the case, we will have an opportunity for you to unmute your mic and ask a question at the end of the town hall.
Thanks for that reminder, Jeff. So Jeff Herndon, who's our Public Affairs Officer, is running the slides for me today, and so I always appreciate that. And we've got a great team that's going to present for you today. So Tracy just let me know that Mr. Payne is here. So Mr. Payne,
He's here.
It's your time to speak. Thanks for being here.
All righty. Good morning, everyone, and my apologies for being a little bit behind schedule this morning. I had a competing obligation, but nonetheless, I am here. So welcome. It's really good to have you all on the call, and I hope that we're able to provide some helpful updates for you. And certainly if there's something else that we did not include with this, please feel free to connect with us and let us know how we can better support you in that way. And so the first slide that you see on the screen relates to our accomplishments, some of them at least. And so I'm very happy to report that the Dole VA Medical Center has once again earned a 5-star rating from the Center for Medicare and Medicaid Services for our overall hospital quality in 2026, making this the 4th consecutive year that we've reached this achievement. This distinction really does set us apart. Not only are we one of just 13 VA hospitals nationally to accomplish this for 4 years in a row, but we're also one of only 3 5-star hospitals in the state of Kansas. And that's not just comparing us to VA hospitals, obviously, that compares us to all hospitals across the entire state of Kansas. And so KU Medical Center and Newton Medical Centers were the only other 2 that accomplished the 5-star rating. And so we're very proud to be in that kind of company. But we know that we certainly are not going to become complacent and rest on our laurels. We know we still have a lot of work to do. We also know that there's still many veterans that have unmet needs, and we're not going to stop pursuing that until we reach every single one of you. And so we're very happy to report those accomplishments, but that's certainly not the end all be all for us. Okay, we can go to the next slide, please. So the next slide focuses a little bit on the VHA reorganization, and you might have heard of this before. I think I may have mentioned it in the past at another town hall or in another venue. And so you will hear RISE, R-I-S-E, being consistently referred to as part of the reorg, and that stands for Restructure for Impact and Sustainability Efforts, and that represents a major step forward for the VHA. And I want you to know that this change, what it means and why it matters. And so RISE is fundamentally about enhancing veteran care. We recognize that our previous organizational structure had been complex and in some cases inefficient. And so this significant increase in duplicative services and siloed structures necessitated a need for a reorganization in the VA, because some of those things often led to confusion and inconsistent communication. So RISE is designed to address some of those inconsistencies and remove some of those barriers and give us clear lines of authority, streamlining processes as it relates to how we deliver care and administration processes as well, and standardized operations across all VA healthcare systems. And so by simplifying our structure, we will continually improve the quality and patient safety of all of our VA care for our veterans. And so both direct and community-based care. And it's also ensure that outcomes for veterans are consistently excellent, as we alluded to in the first slide with our 5-star CMS rating 4 years in a row. That will not change as a part of this reorg. And so this transformation reflects years of work led by dedicated VA leaders, and it remains a top priority for the Secretary of the VA. The Medical Operations Center is a hub that you'll hear about as well, perhaps, which also is referred to as the MOC or MOC. And that is also creating 5 newly Veteran Integrated Service Networks, or VISNs. So we currently have 18 VISNs. We're going down to 5 VISNs. We're creating additional structure for the HSA, which is the health service area or health system area. And we'll talk a little bit about that as well. And those VISNs will assume primary operational responsibilities, those 5 VISNs, so 18 to 5. Under RISE, the MOC ensures, though, that policies, clinical standards, leadership imperatives, and care delivery are consistently implemented. Those offices will still be managed out of the VA Central Office by and large, which is in Washington, D.C. And so we will continue to communicate with those offices and receive guidance from those offices and be strategic partners with those offices as well as part of this reorg. So that isn't changing. So each of the 5 VISNs will work closely with the MOCs and oversee the implementation that spans more than 1,300 VA medical facilities across the nation. And so RISE also introduces dedicated senior leaders for every health service area, or HSA, which you will likely hear a lot about. These leaders ensure facilities have the support needed to deliver timely, high quality, and consistent care without delay, confusion, or mission creep. Importantly, and most importantly, HSAs and the MOC are not additional layers of bureaucracy. They actually consolidate existing functions and they clarify roles and responsibilities, allowing us to allocate more resources directly to the VA hospital systems and directly to you, our veterans. And so to ensure stability, some leaders and staff will be temporarily dual-hatted while the process sort of plays out over the next several months and we go into full operating capacity, meaning that they'll be performing duties from both their previous VISN roles and their new VISN roles as we transition, and same with some of the HSA positions as well. So this is intentional, however, and so we are prioritizing continuity and avoiding operational gaps by doing this and by ensuring that there's sufficient overlap and support for those roles as we transition them. And so over the coming weeks and months, as staff realign, the MOC and the VISNs will increase their functional capacity and refine their roles to better serve you, our veterans. And so we look forward to this strategic endeavor. This is a long time coming. The secretary, the senior leaders across the administration, the president, and others have been very vocal about making sure that the VA works for veterans, not the other way around, and that we continue to prioritize our veterans. And this is following through on that promise and that commitment to veterans. And so we hope that this experience is very seamless to you. There will not be any changes to how we deliver care at our hospital system. This is a management level restructure only, meaning that the only thing that's changing for our hospital is that I will have a new boss, 2 new bosses actually. So I'll have a health service area boss, and then I'll have a VISN boss that are both new from what we currently have set up. And so that is consistent for every other hospital across the VA as well. This should make it more efficient for you. Care should be delivered more timely, more options, more resources to deliver that care in our local hospital system. So we're very excited. Next slide, please. All right, we can go to the next slide, please. Oh, I didn't know that was it. So you can go back one more, Mr. Kimball. I'll talk a little bit about what it means for you, even though I alluded to some of it in the previous slide. So I mentioned earlier that the care you receive at the Dole VA or any of our CBOCs will not change as a result of this reorganization. Staffing and operations at the VA medical centers will remain the same for the most part. There'll be some changes to how we reallocate certain positions and changing different titles and functions. So we're not losing staff as a result of this. In fact, most facilities will gain staff. And so you may see changes in how program offices and VISNs interact. That's an intent to make care delivery better for you at our hospital systems. And so this restructuring is not a reduction in force, and it is not an attempt to reduce staff and make it harder to deliver care at our hospitals. And so the Dole VA's healthcare team will continue delivering high quality care that you all expect and deserve. So we are actively developing and we're testing those workflows, and we will be over the next several months, and governance between these new organizational functions. And then there will be some changes to solidifying certain other FTE across facilities, where we'll gain some support in additional areas, while some of these are still in development. So not every employee's role has been defined yet that are outside of our VISNs. So at our hospitals, no changes. At our VISNs, there will be changes, and at the central office, there will be changes as well. So rest assured, RISE will only impact about 5% of VHA employees, none at our hospitals. And for most of the facility staff, there is no impact for reporting structures, et cetera. So I want to clearly emphasize that, because there are misconceptions. There are also things out there in the media sometimes that can convolute this, that could also make matters a little bit more difficult to understand and process. And so in closing, the VHA is leveraging this unique opportunity to reimagine our structure. We're reducing duplicative management layers. We're putting the right people in the right places. We're going to have streamlined reporting, which means faster care, which means more options and faster action. So standardized practices will improve the efficiency over time, especially in those areas where you have longer wait times, where you have less access to care, et cetera. And so this will also not change how we interact with the community. The community care is an extension, a great extension of VA care. We are not changing that either. And so through this change, our staff can spend less time navigating bureaucracy and more time focused on the veteran, enabling faster access to care for veterans with fewer handoffs. And so we are committed to open communication through this transition. And so if you have questions, concerns, please don't hesitate to reach out to me. You can reach out to any of the other executive leaders. And thank you all for entrusting us with your care, and thank you for your service. And I'll turn it back to you, Mr. Kimball.
Thank you so much, Mr. Payne. It's always nice to hear you speak about the outstanding quality reports, as you spoke of earlier, and the ways in which we're planning to improve as we move forward. Appreciate you taking the time to speak with us this morning. So Charles McFadden, our Chief of Transportation, and I were discussing the benefits of going digital, basically using our cell phones in all different aspects of our lives one day. He then let me know that he'd like to talk to you all about a huge benefit available in travel pay by going digital. Charles, any chance you could help us understand that?
Well, good morning. I will do my very best. Next slide, please. All right, so hopefully a lot of you on this call know, and if you don't, please spread the word. The VA Health and Benefits app is your best friend when it comes to travel pay. It is the quickest and easiest way to receive your travel pay benefits. If you file a paper claim right now, we are running a few months behind. But if you file electronically, you can have the money in your account generally within 3 to 5 business days, except, of course, if there's a holiday or something like that. So if you have access to va.gov, that is a great way to do it. There is also the VA Healthcare app. As some of you may be familiar with that, if you don't, I suggest downloading that onto your phone. You can download it, of course, through Samsung or Apple. It's available on both the app stores in there as well. Next slide, please. And this is what it looks like if you're on va.gov. Just wanted to give a quick screenshot there. And if you look down towards the bottom of that page, I've kind of got it highlighted there where it says file and manage travel pay or travel reimbursement claims. So you can go back through there, you can look at all your appointments and things like that, and you'll be able to decide which ones that you need to file travel pay, or if you haven't filed travel pay, it will list all your appointments on that page as well. You might be thinking to yourself, hey, I don't know how to get onto va.gov, or I don't have access to idme.com, but don't fret, because the person coming up after me will be able to walk you through that process. So next slide, please. All right, so another way that you can file for your travel pay is the text to check-in. Hopefully, if you are a veteran, you receive several alerts about your upcoming appointments, whether it's via mail, postcard, text, email. You're notified probably 5 or 6 different ways that you have an upcoming appointment. But the good thing about that for your appointment check-in and travel pay through your smartphone is that you can do that from the text to check-in as well. And the great thing about that is you'll receive, and maybe it's because I work here, but about 15 to 25 minutes before my appointment, I receive a text asking me if I'm at the VA because it knows that I have an appointment upcoming. If you don't have that feature on your phone and you would like to, as you can see there, there's a text to check-in to 53079, and that will send you a link on how to do that. It will also ask you if you want to file for travel pay, so you can do that as far as, when you're checking in and things like that. You can also request to file travel pay through the text to check-in as well. And next slide, please. So if you previously filed a paper claim and you're waiting, you can still file that claim online. We will attach the paper claim that you filed with our travel pay office in order to process that claim. So if you happen to have filed a claim and you haven't gotten paid for it yet, but you turned in a paper copy, and then you're like, hey, I can do this online, I figured out how to do it, go ahead and file that claim online, and we'll go back through and we'll attach that paper claim to it. Easy, done, processed. So don't worry if it's been over 30 days, because there's the 30-day timely filing. We will still go back through, even if your claim has been sitting there for a month and you file it online, we'll still go back through and we'll process that for you, as long as we have a paper claim on file. The best thing about this is there's no reason to come by the travel pay office when you have an appointment, when you're filing electronically. So if your appointment is on the opposite side of the building or up on one of the floors, there's no reason to come by the travel pay office and sign a piece of paper. get to stop waiting for your travel reimbursement. We have more veterans than ever that are filing for travel pay these days. We get a lot of new filers. So please file it electronically. It is easier for everyone. There's no need to wait. We do hear that, I had to cancel an appointment or I couldn't come to my appointment because I didn't receive my travel pay from my previous one. Well, when you file electronically and you get the money in your bank account within 3 to 5 days, easy peasy. No reason to worry about upcoming appointments because you're already getting paid in a timely fashion. So if you have any questions or you have any appointments coming up and you want help with this, we do have help guides that we can email to you. We also have help guides here in the office that we can hand out to you. If you stop by the Travel Pay office, we can even help you get started as far as helping you download the app onto your phone and things like that. So we are more than happy to help you out and get you started on, filing your claims electronically. Help us. As they say, help us, we'll help you, you help us, we'll get this done in a timely fashion. So next slide, please. There's also a QR code there that we have attached to this presentation where you can scan that QR code and you can also file your claims that way. We are located in the main campus in building 1. We also have a travel email group there. If you have any questions, you can email us. We'll get back to you. Also, our travel pay extension is there as well. And then if you still feel like you need to send those claims by paper, or if you're at the doctor's office and they want to fax something over to us for your proof of attendance, you can do that there with the fax number as well. Other than that, as everyone, like I said, mentioned, everybody wants to know, how do I get to idme.com? How do I get to va.gov? Well, Jesse Comey is up now, and he is going to explain to you exactly how you can get to va.gov.
Thanks, Charles. Good morning. Like you said, my name is Jesse Comey, and I am the telehealth coordinator here at the facility. And I'm going to talk to you a little bit about My Healthy Vet and va.gov. Next slide, please. If you weren't aware, My Healthy Vet is like your patient portal here at the Dole. It allows you to do things like manage your appointments, refill prescriptions, view medical records, and send secure messages to your healthcare team. My Healthy Vet has gone through a bit of a transition a little over a year ago with 2 major things changing. The first major change was that it migrated from a standalone site to being now integrated as part of va.gov, which has made va.gov a one-stop shop for everything you need, from benefits claims, travel claims like Charles was discussing, and managing your healthcare in an effort to have it all in one place. The second major change was that they moved away from the standard username and password to a more secure authentication method, offering 2 new ways to sign into va.gov and the VA Health and Benefits app. One being login.gov and the other id.me. Creating one of these authenticator accounts can be pretty straightforward, but we have run into some bottlenecks since the transition. Some of the big hiccups come from things like address changes, email address changes, and phone number changes. These can all cause people to be locked out of their accounts. In these instances, the best course of action is to use the national helpline that you see there on the screen at 877-327-0022. And they can get you connected directly with login.gov or id.me, specifically for things like account resets. For most other inquiries, or if you're needing help setting up a new account, you can always come down and visit us at the Dole in the My Healthy Vet office in room 124B in building 61. And on the next slide, we're going to go through a quick demo on how to actually create an id.me account for the first time. And there you go, roll it, Jeff.
Creating your ID.me account. To create your ID.me account, go to va.gov and select Sign In. On the Sign In screen, select ID.me. Now select Create an ID.me account. Enter your personal email, then create your strong ID.me password that meets these requirements. At least 8 characters, at least 1 uppercase letter, at least 1 lowercase letter, at least 1 number, and don't include these things in your password. common phrases or repeated characters like ABC or 111, personal dates like your birth date, parts of your email address, and parts of the same password you use for other accounts, like your bank account or email account. Then accept the terms of service and privacy policy. Then select Create Account. Check the inbox of the personal email address you entered to create your account. You'll find an email from ID.me. Select Confirm your email. This will take you back to the ID.me website, or you can enter the 6-digit code from the email on the ID.me website. Now that you've created a strong password to protect your account, let's set up your multi-factor authentication, commonly referred to as MFA. MFA is an extra layer of protection on your sign-in account that helps us make sure that it's you accessing your account and not someone pretending to be you. ID.me will share several MFA options you can choose from, including a recovery code you can generate at this time in the process. We encourage you to choose at least 2 methods. After you successfully add your MFA, you've made it to the final step of the process. ID.me will ask your permission to share your information with VA. Select Allow. And that's it. Now you're ready for the next step, verifying your identity for your ID.me account.
There you have it. Seems pretty easy, right, when watching a video. But like I said, we definitely run into some bottlenecks. So if you have any trouble, you can always call the National Help Desk or give us a call here at the Dole. We've got a few resources there on the screen with more information, and that also includes our phone number. So if you do run into trouble creating a login.gov or an ID.me, definitely feel free to reach out. But that is all I have.
Jesse, there was a question regarding login or ID.me. Will VA eventually be accessible through MyAuth? There seems to be too many multiple ways to sign into a variety of sites. If possible, you might be able to answer that through the chat for Mr. Broxton.
I'll type that in the chat.
Okay, thanks. Well, thanks, Jesse and Charles. Appreciate that information. The travel pay benefit does sound like a great deal. I mean, I don't think there are many of us who would complain about getting their money a little bit more quickly now, would there? So thanks again. Next slide. So VA is committed to a culture where everyone is treated with civility, compassion, and respect. Everyone should feel welcome and safe when doing business with the VA. So to accomplish this, everyone needs to understand what is and is not acceptable behavior. Our harassment prevention coordinator, Lydia Neurath, is here to share information with you on our program and the reporting process. Lydia?
Thank you, Gene, and thank you all for joining us today. As the harassment prevention coordinator, it is my role to ensure that we're providing a safe environment for our veterans that we serve, as well as our staff. This means an environment free of harassment, sexual harassment, and sexual assault. Studies routinely show that upwards of 50% of healthcare workers experience sexual harassment. This rate is significantly higher than any other industry. And our VA here is committed to a place where everyone is treated with courtesy, compassion, and respect. Here on the screen, you'll see definitions for harassment, sexual harassment, and sexual assault provided by the VA. In the interest of time, I will not review all of the examples under each definition, but harassment is defined as unwelcome and improper behavior based on quality of an individual. Examples here listed in the bullets. Also, for sexual harassment, this is unwelcome verbal or physical contact of sexual nature. These can include jokes, materials, videos, stalking, those sorts of things. And sexual assault is defined as unwanted conduct or attempted conduct without consent. This can also include unwelcome hugging or touching of an individual. So when a patient is suspected of committing a violation of these, we have an interdisciplinary team who reviews all reported incidents of actions described and determines if corrective action is necessary. We seek to provide our staff with safety and respect in the care of veterans. Next slide, please. But should you as a patient ever experience harassment or assault, please reach out to any of the offices listed here, the VA Police, the Veteran Experience Office, or myself. My contact information is there, as well as the hotlines, which are open 24 hours a day. I am located here at the Wichita campus, but cover all of our CVOC locations as well. And I want to ensure that both our patients and staff are treated with respect and provided with a safe working environment. And that I ask for your help. Thanks, Jean.
You bet. Thank you, Lydia. Appreciate that. So moving on, knowing that last night was the Major League Baseball All-Star Game, this is where I'm going to start throwing you a change-up. We're going to move from the harassment presentation straight into our whole health moment, of which this quarter we're going to hear from our recreation therapist, Caitlin Hall. Caitlin?
All right. Hello. Thank you, Jean. So like Jean said, my name is Caitlin. I am our whole health rec therapist, and we're going to talk just a little bit about promoting health. So what is rec therapy? If you haven't heard of it, we use your leisure interest to promote your overall well-being. We work on your goals that you currently have. We work on things that you'd like to build on. We use your goals that you currently are working towards and the skills that you currently have, as well as building new skills and helping eliminate those barriers. So next slide, please. All right, so some of the leisure interests that we use to get to your goal. We use leisure skills. Those are things like learning social interactions, planning and problem solving. We also use leisure education. So that's learning different and new hobbies, finding different support groups. And then the reintegration factor we find really big with our veteran population. So learning to use transportation more safely, accessing different community resources, those veteran discounts, local discounts, and just building confidence within the community and connecting with other veterans. So next slide. All right, so instead of listening to me yak about what whole health and rec therapy are, we are going to challenge your brain real quick. So we're going to switch things up and listen to a few songs over the next 45 seconds. Feel free to grab a piece of scratch paper, remember in your brain, or grab your notes app on your phone, and we'll get ready to get started. So our first song, 10 seconds in, think about the name of the song, and if you want to challenge your brain, think of the artist. Here we go. All right. There is the first one, and real quick, Jean, did that come through real clear?
No, I don't know where your mic is. Is the mic up on your head?
Okay. No, I have a camera mic. Let's try again here. I think it might have noise suppressed.
We're good.
All right, there was song one. So again, think of the name of the artist and the song. And we'll get to the next one here. Give everyone just a moment to think of their answer. All right, here we go. Song two. All righty, and we'll again give a second to think about that name. And our last one, here we go. All right. So, okay, if you played along with us, the songs were 9 to 5 by Dolly Parton, I'm Still Standing by Elton John, and last but not least, Party in the USA by Miley Cyrus. So I see a few comments coming in. It looks like some people got the answers. Again, just a fun little game to get your mind thinking. So let's go to the next slide and look at why that was important. Okay, so with rec therapy, a lot of times I get, oh, you get the fun job, you get to do the fun things, but we put the fun in functional is what we like to say. So with music trivia, not only are we having fun listening to music, but we're also reminiscing. We're working on recall, we're working on increasing your concentration, and we're working on word fluency if we're doing karaoke. A few of the other groups that we do here in Whole Health, especially with our therapy, if you ever see me play a game of Uno, while we're having fun and being competitive, we're also learning to follow directions, sequence, and work on frustration tolerance.
Our walking group often goes to the zoo to walk and get out in the community. So we're working on moving the body, regulating our emotions in crowds, and community engagement. And just to pull one more out there, when we go bowling, sometimes we use the ramp through the bumpers. It might not look like to everyone we're being super competitive, but we might have veterans that are relearning a new skill, overcoming limitations for whatever those might be, or just integrating into the community after a loss or an injury. So these are really important skills that you need to learn, and we just make them fun. Oftentimes when we're doing something fun, we don't realize that we're also working. So that is where rec therapy comes into play, and we make the fun functional. All right, next slide. So real quick, I just want to highlight on a couple new things that rec therapy is coming up with. I have recently partnered with our caregiver support program. I did become a dementia engagement specialist recently, so we're really partnering on the cognitive side of veteran care and continuing to make sure that we are maintaining those cognitive levels. So we do have a cognitive games group opened up. Our walking group is also open to caregiver veteran combos. It's a nice way to get out, move, and connect with other veterans, other caregivers. I am able to go out in some scenarios to do home visits one-on-one with caregivers and veterans, find things around the house to keep them engaged in. And I also work with caregivers to make a toolbox, to give them supports to help them keep a veteran engaged, to help them enjoy their time, just to make sure that both the caregiver and the veteran are taking care of themselves. So we were talking a minute ago about our bowling with ramps. We have tried to integrate adaptive sports more into the Dole VA here. So we recently did have 2 pickleball clinics open up. They were greatly enjoyable and attended, and we're hoping to advance and continue a few more of those as the weather starts to cool back down. And then at the bottom, I just included a few ideas of some things that veterans have brought to me, saying that they are interested in. So we're exploring those options and seeing how they might fit in with the Dole VA and how well they're intended. But I do encourage any veterans, if you are ever interested in something and you're looking for other veterans to engage with, or you're not sure how to get something started, or if you're interested in any of our national games through the VA level, contact me and let me know that you're interested in those things. I might have other veterans that have also said the same thing and are just looking for other people to enjoy them with. But I definitely recommend reaching out, because the biggest thing we want to do is keep our veterans engaged and socialized together. All right, and next slide. Okay, and lastly but not leastly, you can either, like I said, reach out to me, or you can talk to your provider about your current interests and levels of activity and see if any of our whole health offerings might be something that would benefit you. All right, thanks so much.
Thank you, Caitlin. First of all, that was awesome. It's always nice to have a little fun during, quote, meetings, while at the same time learning about the benefits of VA programs. So appreciate your time on that. Speaking of the benefits of VA programs, sometimes these programs are internal and meant to improve your health, but also to improve the processes of providing veterans quality health care. Today, Dr. Nick Nelson and Chris Graves are here to discuss one of those processes with you. I think Dr. Nelson's going to start it off. So, Dr. Nelson.
All right, thank you. Welcome, everyone, and thanks for joining us today. My name is Nick, and I'm here to talk to you about the vital part of your health care, how the VA reviews your meds to keep you safe. Next slide. Thank you. A medication review is also called a medication reconciliation, is when we work together to make sure your medication list is accurate as possible. We look at every medication you're taking, not just prescriptions, but also over-the-counter drugs, supplements, vitamins, and even supplies. It helps us catch mistakes and make sure your healthcare team knows exactly what you're taking at all times. Next slide, please. There are a few important reasons for these reviews. First, we want you to prevent medication errors, such as missing or duplicate drugs or harmful drug interactions. Anytime your care changes, such as coming to the hospital or leaving, you may see new doctors or nurses, and we want everyone on the same page about your medications. Ultimately, this process is about protecting your health and safety. Next slide, please. So the VA, as it says in the slide, we use a special process called medication reconciliation. So every time you go between places of care or when you go home from the hospital, which means you could go from, have an appointment with your primary care in the morning and then see your cardiologist in the afternoon. We need to do a medication reconciliation at each visit. And our ultimate goal is to work with you and your family to make sure your medication list is right when you leave the hospital or the office. Next slide, please. To make sure we do this right, the VA has official rules or policies. One policy tells us that checking your medication is required during every change in your care. Another policy gives us staff step-by-step instructions on how to do these checks and keep your records accurate. These policies help us follow national best practices and deliver the safest care we can. Next slide. And with that, I will turn it over to Chris.
Okay, thank you. So what does this mean for you as the veteran? So as Nick has mentioned several times, that part of our goal is to make sure we have an accurate medication list, even as you move between different points of care throughout your time at the VA or another healthcare system. So at every time you visit a VA, a nurse, a pharmacist, a doctor, any member of the clinical team will review your medications with you. And this will involve a line by line, med by med review. And like Nick said, we want to make sure we're accounting for all of your medications, which can include supplements and other things.
Will review your meds with you. You might also get a telephone call before your appointment to review your meds.
And then one of the other things too that might happen is that we will get, you may have a telephone call before your appointment. Some of our clinics are trialing this to where a nurse or someone from the team will call you in advance to go over parts of your appointment and also review your medications. Again, this helps to make sure we have an accurate medication list when you see a member of your healthcare team. Some of your services may ask you to actually bring your pill bottles to the appointment or to at least write down a list of what you take at home. Again, this is all to make sure we have an accurate list, accurate record of what you're taking, but also makes you part of your health care while we're caring for you here. Next slide, please. So how can you be involved? Always bring an update list with you. You don't necessarily have to bring your pill bottles unless your care provider asks for that. But definitely at least having an up-to-date list with you every time you see a healthcare provider is extremely beneficial, especially regardless if you're being seen by the VA or an outside health entity. Make sure you tell us about changes in your medications, allergies, or side effects. Some people are tried on different medications multiple times a year, or they see outside providers, and we don't always have those records minute by minute. So again, it's important to let us know what's going on, if you're having any side effects, those kind of things. And always, if you have questions about your medications, ask a member of your healthcare team, and don't be afraid to ask a specialist. Whatever the circumstances are, make sure you're comfortable with the medications that you're taking. Next slide. So with medications again, it's the review is a team effort. We want to make you at the center of your care, and we do this to keep you safe from harm and to make sure that your care is the best that we can provide. Remember, your voice matters. Always speak up if you have questions or concerns. Next slide. And that's all we have for now. If you have any questions or concerns, please reach out to either one of us or ask a member of your healthcare team. We're here to support you.
Hi, Chris or Nick. This is Gene. We have a hand up, so can you go ahead and ask your question, please? You're going to need to unmute yourself if you can.
Mr. Lee, did you have a question? Jason Lee?
Okay, we're going to go ahead and move on. Mr. Lee, if you'd like, feel free to put your question. Oh, he put it in the. Chris Graves is apparently talking and not muted, but I can't hear him. Mr. Lee, I don't know how to answer that because I think everyone else could hear. So there must be something on your end that's causing a problem. This will be recorded though. So in a little bit, I'll show how to get to this recording later on. So we're going to move ahead. Thanks, Dr. Nelson and Chris. Appreciate your input on this. What you just heard was one piece of a very large pie when it comes to, for example, the CMS 5-star rating that Mr. Payne discussed at the beginning of today's town hall. We're glad that we have staff like you and the committee who are continually looking at ways to improve the way in which we provide care to our veterans. And last, but definitely not least today, we're going to hear from Mindy Wynn, one of our healthcare engineers, about ongoing construction projects here at the facility. Mindy?
Thank you for the introduction, sir. Campus construction, can we go to the next slide, please? Thank you. Campus construction continues to progress across multiple projects. For Building 26 infill, it is advancing with the renovation of the first floor east wing, with the move into the new cantina space still to be scheduled. The endoscopy project is moving forward. The structural steel is nearly completed. The floors are poured and wall layouts underway. The targeted completion date is going to be Q3 for the fiscal year 2027. The CLC addition is also progressing with drywall installation and above ceiling utility works ongoing, similarly slated for the completion in Q3 fiscal year 2027. And then for the Building 61 eye clinic and audiology projects, the AE, which is the architects and engineers, are going under negotiations, are currently in progress, and the design is expected to begin in early Q1 of fiscal 2027. And so then we have install a new wayfinding, and then replacing the nurse call and public address systems are currently underway or planned, and the major installations are anticipated for the fiscal year of 2027. And then if we go to the next page, please. This is just images of the new canteen and retail store. And then next page, please. And then this is the newly addition for the CLC buildings and the Endo project. Next page, please. Thank you. I'll give it back to Sir Gene.
Thank you, Mindy. Appreciate that. There are so many projects going on right now, and it's going to be great when they all open up. So this brings us to the question and answer portion of the program. What I'm going to do real quickly is, Mr. Lee, I thought I could, Jason Lee. I thought I would be able to unmute him, but it doesn't look like I can. Mr. Lee, if you can hear me, go ahead and unmute yourself and ask a question. Jeff, are there any other questions in the chat that we need to answer at this point? I don't believe there are.
We need to respond to Mr. Broxton's question.
Okay.
And so Mr. Broxton asked early on if, let me get to it. Are there long-term living arrangements available for veterans who become physically disabled? Are there family-type facilities? Thank you. So, Mr. Broxton, we have a few options. Mindy just mentioned that we're in the process of expanding our community living center. This essentially is a assisted living facility for veterans that is located here at the VA Medical Center. And then we do also have veterans who live at assisted living facilities and nursing homes out in the community that in some way, shape, or form the VA assists with or fully finances those stays. We have, with regards to a family situation, our home-based primary care option, which if you are homebound for some reason or traveling distances to get health care is difficult for you, then you could be assigned to a care team out of our home-based primary care service. And then finally, we have our medical foster home, which is more for veterans who may not have a family, not have a place to stay. We have individuals in the community who volunteer to become essentially their caregivers and make their home available to them. Those homes have to pass a rigorous inspection and be registered with us in order to qualify. All three of those options you should be able to discuss in detail with your primary care team. If for some reason your primary care team didn't have the in-depth information that you needed on any of those, they could easily refer you to our geriatrics and extended care service that operates all three of those services that we offer. And of course, through the state and specifically through Kansas Office of Veteran Services, there are two state veteran homes operated here in the state of Kansas. One is in Dodge City, the other one is in Winfield. And again, the VA, the federal VA, and the Kansas Veteran Services Office work together to operate those two facilities with, I think, most of the funding coming from federal VA and then most of the manpower and operational aspect of it coming from the state level. We do have a couple of representatives on from KOVS today, at least they were, General Turner and Mr. Roletter. And so you could reach out to them. You can get their contact information off of their website, or maybe one of them might be able to pop it into the chat so that you could get details about the state homes from them as well. And as I'm not an expert on these, but I do have that basic knowledge right there that I just shared with you. And again, I think further details would be best provided by either your primary care team or our GEC, Geriatrics and Extended Care. Thank you.
Thanks, Jeff. And that's why we like having Jeff on this meeting, is because he's got this huge amount of knowledge that unfortunately I don't have. But it looks like General Turner was
Jack of all trades and master of none.
Good for you. So General Turner was on, and Mr. Broxton said, thanks, great response. So appreciate all of that. I don't think that we have any other questions that are showing up. If anybody needs to unmute themselves and ask a question, feel free. If not, go to the next slide. I said this earlier.
I could ask a question.
Oh, go ahead. I'm sorry.
Sorry. I currently have a claim for an under 65 non-service connected pension. It's already booked through a VSO. However, in va.gov, it won't show the files that my VSO submitted for me. So I expect the only way I can see exactly what he submitted, which I expect is exactly what I asked for, is to call him back and ask to view his screen, probably in person, to see that it is submitted the way I wanted it.
So
and I'm
Jeff,
wondering if that's right.
Jeff, I'm going to ask for your help on that one. To me, it sounds like a VBA question, but
it really is. And in addition to that, working with the VSO that he is working with, I really can't. That answer is going to have to come from the Veteran Benefits Administration. And so there is a Wichita regional office, Jason. If you just Google them, they have their own website. As a matter of fact, while we're doing this, I'll try to jump on there and find it and provide it in the chat for you.
Okay, so you're just saying, yeah, va.gov is never going to show that, and I'm just going to have to go through my VSO to.
That is not what I'm saying, sir. What I'm saying is the VA is organized into 3 different administrations. There's the Veteran Benefits Administration, who handles disability claims. We are the Veterans Health Care Administration, so we operate the hospitals and employ the staff who provide you with your health care. And then the third one that isn't pertinent here, but it's the National Cemetery Administration. So that, with regards to questions about a disability claim, you've really got to take that up with VBA.
Okay, that makes more sense.
Okay.
Thank you.
You bet. And I think Jeff said he would try to put something in the chat to help you out with that. The VBA office is out on East Douglas here in Wichita. So Jeff will try to get that information for you. So appreciate that.
Okay.
The other question was from Loy. Go ahead, sir. You're going to need to unmute yourself.
You know that Jack is in the hospital, and that is your focus.
That's your focus.
Do you have a question?
Governor.
Can you repeat that? I'm not seeing an unmuted mic, so what I'm going to say is for a copy of today's presentation, you can send an email to the email address on the screen, or you can review the recording of this video and the PowerPoint presentation on our webpage, Dole VA's webpage, which is www.va.gov/wichita-health-care/about us. And that will be there later this afternoon, both the recording of this presentation and the PowerPoint presentation. So with that, thanks for joining us today. Look forward to seeing you again soon. Thanks a lot and have a great day, everyone.